Hello and welcome back to my channel. This is your favorite plastic surgeon, Dr. Priya Bansal. Today we are going to answer some of the most frequently asked questions about the famous Brazilian butt lift. Brazilian butt lift is a surgical procedure designed to enhance the shape and size of the buttocks. Now, this is achieved by using fat transfer techniques to take fat from other areas of the body, purifying it, and then injecting it into the buttocks. Over the years, I have received a lot of questions from patients who are considering this procedure. So, without further ado, let's get started.
I played it innocent, a feel of discontent. I'm finally facing it all, fearless.
A good candidate for buttock augmentation is someone who has realistic expectations and is in good overall health. Now, ideal candidates, they should have enough fat in other areas of their body so that this fat can be harvested, processed and put back into the buttocks to give them buttock augmentation. The length of the procedure, it can vary depending on the amount of fat which we are planning to transfer and also whether we are doing additional contouring procedure for the patient. But usually it takes somewhere around 2 to 3 hours to complete. Now, the procedure is performed under general anesthesia. So you will not feel any pain during the surgery. However, after the surgery, you can expect some discomfort and swelling, which can be managed with pain medications, which starts immediately after the surgery. And this discomfort and pain, it gradually decreases as the swelling subsides and as you recover. Now, most patients, they can return to work after 1 to 2 days after the procedure. However, they need to avoid sitting and they need to avoid lying supine, that is on your back. So whenever they lie down, they have to lie prone on their tummy, and whenever they sit, they need to sit on customized pillows which are called BBL pillows, which has a cushion, a padding to keep the buttocks in the air. This has to be followed for at least 3 weeks so that whatever fat has been transferred into the buttocks, they do not get absorbed. The results of Brazilian butt lift are long-lasting and permanent. In the initial 4 to 6 weeks, around 30 to 40% of the fat, it gets absorbed. And whatever remains after this initial period, this remains permanent. Having said this, if you gain weight, you will gain weight overall into the buttocks as well, and if you lose weight, you will also lose weight from your buttocks. Now, the incisions made for Brazilian butt lift for harvesting the fat, they are very small, around 4 to 5 millimeters in size, and they are usually placed at areas which are hidden in the natural contours and creases of the body. As a result, the scarring is minimal and the recovery is fast, and the scars, they gradually fade with time. Yes, like any surgical procedure, there are certain risks associated with Brazilian butt lift as well. Some risks may be infection, bleeding, hematoma, scarring, asymmetry. The most serious risk is fat embolism, which had put the entire procedure into disrepute. But this happens if the fat is put into the muscle. The risks, they can be minimized by choosing a skilled and experienced surgeon who knows and uses advanced techniques. For Brazilian butt lift specifically, using expansion vibration lipofilling helps in preventing fat embolism because it avoids putting fat into the muscle. You can watch my video on expansion vibration lipofilling on my YouTube channel. The link is provided in the description below. If you have further questions or would like to schedule a consultation, please find my contact details in the description box. Thank you for watching and I'll see you in the next video. Bye-bye.